Welcome, everyone, to Creating a Family, Talk About Infertility. Today, we're going to be talking about getting the most out of your infertility insurance. You know, health insurance coverage for infertility treatment feels like a black hole for many of us. Honestly, I sigh deeply anytime I think about insurance. But it's also vitally important to getting coverage for this disease. And so we've got to talk about it. So in honor of having to talk about it, we will today. And fortunately, we have two guests who are very knowledgeable and can help us untangle some of the black holeness that I find this topic to be surrounding me with. We have Dr. Dan Potter. He is a board certified RE with HRC Fertility in California. We also have Davina Fankhauser. She is co-founder of the nonprofit Fertility Within Reach, and their mission is to increase access to benefits for fertility treatment and fertility preservation. Welcome both Davina and Dr. Potter to Creating a Family. We are so glad to have you to, like I said, to help unravel what I find to be a very confusing topic.
Thank you. It's great to be here.
Yeah, good morning.
Yeah. Okay, let's jump in. All right. Treatment for infertility, and I must say, unlike most other diseases, is not often covered or not always covered by health insurance. Or if it is covered, it's covered in a lot of various ways. So I want to start off with just breaking down the different ways that health insurance can cover infertility, both the diagnosis and the treatment. Davina, I'm going to be directing these questions to you because I know that's what you do. That's what you do day in and day out. So, so some policies do not cover fertility insurance at all. So, and that would include both the diagnosis as well as the treatment. So how common is it in the U.S., and I'm only speaking in the U.S. right now, how common is it in the U.S. for a policy to not cover anything, Davina?
It's typically not covered in the U.S. We are finding, even states with insurance mandates, there will be a significant population without coverage because there's a federal law that says if a business is defined as a small business, or if they are self-insured, they are not required to provide these quote unquote mandated health benefits to cover infertility and treatments such as IVF or intrauterine insemination. So there is a large gap there. But the good news is some of the self-insured employers, regardless of whether there is a state mandate for benefits or not, these self-insured employers are understanding there is a benefit to provide the coverage. And so they will offer this as well. So it's important to understand if you move to a state hoping to get coverage because they have a law, it doesn't necessarily mean you'll have coverage. And if you live in a state where there isn't a law, you might be able to find employment that still offers the benefit.
Yeah, good point. All right. So when you say that health insurance, most health insurance does not cover it, I actually think that we could probably break that down a little because I think that there are definitely policies. So we have some policies that cover nothing, right? I mean, absolutely nothing. But we also have policies, health insurance policies, even in non-mandated states that don't require insurance companies to offer. Even in those states, some health insurance policies will cover the diagnosis for infertility. And in some ways, that may be one of the more common ways that we see it, that diagnosis, or at least diagnosis of the underlying conditions that may be causing. And in fact, even policies that don't cover infertility treatments or diagnosis might well cover some of the underlying conditions. Dr. Potter, what would be some of the underlying conditions that health insurance policies would cover the diagnosis and treatment of, which the treatment of this underlying condition may render the person fertile again? So what are some of the conditions that we would think of that people can, that they'd be important for our audience to understand?
Well, I mean, I would say first and foremost would probably be endometriosis. I mean, so when patients have endometriosis, that is a medical condition. It's generally covered under the medical portion of their policy, and treatment of that is usually justified under the medical policy. Another condition would be uterine fibroids. Uterine fibroids are benign tumors of the muscle wall of the uterus, and they can, significantly interfere with one's ability to conceive, and they are, the removal or treatment of the fibroids would be covered under the medical portion of one's insurance policy. Another situation would be uterine polyps. Endometrial polyps are benign fleshy growths of the uterine cavity that will interfere with conception, and the treatment and removal of those should be covered. But there are other things as well. So if a woman has irregular periods, there's a number of different underlying endocrinologic, dysfunctions that it could be, and every insurance policy is going to allow your doctor to figure out which one of those issues is causing the irregular periods. Additionally, if you have the heavy periods, what we call menorrhagia, where you have an abnormally heavy period, or if you have abnormally frequent periods, this is also something that should be covered under your medical, the medical portion of your insurance policy. On the male side, if the male has some sort of functional issue, so if they have diminished libido, difficulty maintaining erections or achieving orgasm, these are things that can be bundled under the diagnosis of testicular dysfunction. And at least the endocrinologic portion of that workup, which would include, getting hormone levels, blood tests, and potentially a physical exam, those things would be covered under the medical portion.
So the real point here is, don't just make the assumption that if you have a policy that does not cover infertility, don't make the automatic assumption that no part of diagnosing and treating why you are not getting pregnant will be covered.
Right. And the other thing I would add there is it really depends upon your physician basically checking the right box, as in terms of why you're there for that particular visit. So there's a box that's just basically reproductive related counseling or fertility testing. And if they check one of those boxes, and you don't have fertility coverage, no matter what they do, it won't be covered. Whereas if they select one of the medical diagnoses, they can, you can, often have these things covered.
I'm so glad you brought that up. As a patient, how is that viewed if I come up to my doctor and say, look, I don't have coverage for infertility, but I hardly ever have a period. I've got acne. I've got, I describe some various symptoms that I think could mean that that might be affecting my fertility. I want you to make sure that you check the right box. How is that perceived by a doctor? Is that perceived that I am a pushy, overbearing patient, or a non-trusting patient, or or a smart patient?
I mean, I would view it as somebody that is a smart patient, but I think that it just depends on the physician. I would suggest that patients seek out physicians that are not defensive about stuff like that because it's your care
Yeah.
and it's your money.
Yeah, exactly.
And doctors are not always, really that in tune with, insurance issues and maximizing coverage for their patients. And, there are other aspects of that come into play, such as where you have laboratory work performed, so a lot of us have, like myself, we have an endocrine laboratory, right inside of our facility. And so it turns out that in our case, we are contracted with all of these different, pretty much every insurance company, but that is not always the case. And so if your physician orders testing that may otherwise be covered and they actually check the right box for the diagnosis, but they send you to a non-contracted laboratory, that would end up probably negating any coverage that you have. So it takes a lot of care and thought to negotiate through these treacherous straits of maximizing your coverage.
Yeah, that's exactly right. And we're going to circle back to that about how to make certain you don't end up getting surprising out-of-pocket expenses. So I'm going to come back to that, but that's a very good point. Coming back, though, to how we originally started as to the different ways that insurance, health insurance in the U.S. might handle coverage. Another way is where a policy might cover very limited treatment, and usually the one that we see would be something like an oral medication, letrozole, Femara, or Clomid or clomiphene citrate, one of those where it's just one of the oral meds. And then there are some fortunate folks who do have wonderful full infertility insurance coverage. Davina, at the beginning you mentioned that in mandated states, that means that's kind of our slang for our shorthand for the I guess it's 16 states now, isn't it, Davina, that, or will be 16 when New York it comes online, where some type of the policy, if you're going to sell insurance in that state, you have to include policies that cover fertility. What's the number, Davina, now?
Well, I thought ASRM, the American Society for Reproductive Medicine, said Delaware was 16, so then that would make New York 17.
Yeah, you may be right. And that doesn't mean that you're, depending on just because you're a mandated state, you live in one of the mandated states. And to find out, you can just Google it. We won't rattle all 17 off right now. But you can just Google mandated states for infertility insurance, and there are many lists out there, including on our site, creatingafamily.org. But just because there are a few states that require that the policies be offered, but do not require that the employers use that policy. That's the choice of the employer. But before we talk about, and then as Davina mentioned, and then we have a lot of, especially larger companies, which are what we call self-insured, and then they get to choose regardless of what state they live in. But we're going to talk about that more towards the end. But what I wanted to get to now is when we say that we have policies that cover full coverage, what do we really mean by full? Because I think that's a bit of a misnomer when we say full coverage, because oftentimes there are certain limits. So Davina, what are some of the common limits that you might see in policies that cover insurance? Cover infertility.
So the most common that I see is related to the number of cycles of IVF that can be completed. Insurance companies are now including as a quote unquote cycle a frozen embryo transfer, not just egg retrieval, which has been unfortunate for these patients in these states or with these policies. There could be a lifetime dollar limit And I actually had a conversation with the head of benefits at TJX. They run TJ Maxx, Marshalls, Home Goods. They have a $15,000 maximum. And I was explaining to them how by having that dollar limit, they are creating a disparity within their own corporation, because the cost for an IVF cycle, say in Massachusetts, is very different than it is in New York City. And so dollar limits can be extremely restrictive. I think just one other limitation is that just because someone has insurance coverage, they may not meet the medical guidelines required by the insurer to show that there is a medical necessity to cover this treatment.
Give us an example of what you mean by a medical guideline.
The insurance carriers are allowed to create their own health guidelines to determine if a patient is eligible for the benefit. So, for example, a patient must have a follicle stimulating hormone level less than 12.0. So if a patient has 12.1, but then later has a 10.8, the insurance company will say, I'm sorry, you had one level that was above our 12.0. You do not meet our guidelines. Therefore, there is not a medical necessity, or we don't believe you have greater than a 5% chance of live birth. They will find a reason to show that you do not meet the guidelines to be eligible for the coverage.
And that sometimes, and some policies actually have another way of getting to that would be an age limit. You have to be under a certain age. And they may not call that a medical guideline, but that's sometimes also a limitation that you may bump up against.
Right. And those limitations can be set up either by the insurance carrier or if the state law has an age limit.
Yeah, that's a good point, because sometimes it's actually the enabling legislation that sets up an age limit. You're right. So it could be created either way. Good point. Good point. And Davina, one last question. When we talk about what some limitations on when we say that your policy does cover, there are also potential limitations on certain procedures. And sometimes even certain medications are specified. How often do you see? What are some of the? Let me ask this: what are some of the procedures that you sometimes see specifically excluded from coverage?
It's really interesting that there are exclusions for anything that is considered experimental. So we now have more coverage for cryopreserving eggs or oocytes because it's no longer considered experimental. But there is limitations regarding pre-implantation genetic screening. Interestingly, though, some insurers will cover pre-implantation genetic diagnosis. However, they won't cover the IVF, which is required to complete the genetic testing of an embryo. There are often limitations regarding what we call ICSI, which is where, in layman's terms, they will wash the sperm, find a great sperm, inject it into an oocyte to hopefully see an embryo develop. And Dr. Potter, you can correct me if I did that incorrectly or I explained that incorrectly. But they may not cover that. They may say the man's sperm was healthy enough that ICSI is not required. And some of the medications, they will limit either the amount of medication or the type of medication that the patient requires for the most appropriate medical care.
Well, and I'm not speaking for you, Dr. Potter, but I am sure having insurance companies dictate how you practice medicine is a frustration.
I would say so, but one of the things I would say that is frustrating to me as a practitioner is, in California, we're a non-mandated state, as most of the country is. So there is no law that requires employers to provide infertility coverage to their employees. Now, that being said, the policies, some of the employers, out of the goodness of their heart, will provide some level of insurance coverage for patients or for their employees, even in non-mandated states. And I would say the most common type of policy that I see is one that has a lifetime max.
Mm-hmm.
And I can't tell you how many times I have seen, patients that have a lifetime max, and it might not be a lot. It could be only $10,000 or, something like that. But it's often like $10, $15, or $20,000. And they will have been with their OBGYN doing Clomid cycles for a year and just basically eat through that entire benefit. Whereas, they would have been much better off, having a thorough evaluation with a fertility specialist in the very beginning, and then making an informed decision about how to utilize that and whether to do in vitro fertilization with it, which gives them a much higher chance for success. Even if it doesn't cover a whole cycle, just using that to sort of offset the cost of in vitro fertilization even. And so that is something that I will see, unfortunately, relatively frequently, where they have coverage and they're excited about it. And then when we check with the insurance company, they have eaten up, a big chunk of their benefit doing relatively ineffectual treatment. So I cannot explain. I mean, just things like Clomid when the husband has a suboptimal semen analysis, and it's just not, it's just not going to have a very high chance for success.
I am so glad you're bringing that up. That's actually one of our missions here at Creating a Family. We see the very same thing. People staying too long with their gynecologist. And it's especially tragic, really, when they do have some coverage and they use up a large portion of their coverage. I'm just repeating what you're saying, when ultimately their best chance of getting pregnant and having a baby would be to, even if it doesn't cover the whole thing, if they could get and save up for the remaining part they can't, So I totally and completely agree with you. Let me pause for just a moment and remind everybody that you're listening to Creating a Family, talk about infertility. And today we're talking about getting the most out of your health insurance. A very important topic, to put it mildly. This show is brought to you by the underwriting support of our corporate sponsor, Ferring Pharmaceutical. For women who have been undergoing fertility treatment and are still struggling to conceive, Ferring wants you to know about the Ferticom app. It was designed specifically to help women address the many challenging emotional life situations that arise while struggling to conceive. They go through daily scenarios, and they give you specific. The thing I like so much about the app is they give you specific things that you can do, and that really have been proven to help you cope with some of the really hard parts of infertility. And we thank Ferring for their support. Now, we're going to be talking about what Dr. Potter said was a great lead-in to a question we got from one of our audience. Courtney asks, she says, we have been trying for almost 3 years, and I've been on Clomid with my OBGYN for 1 year. I'm fed up, and I'm finally taking your advice you give to make an appointment with a specialist. So I'm really glad you're covering this topic today. The only thing my company gives us is a summary of benefits for our insurance, and it doesn't say anything about infertility. Does that mean I'm SOL? And I'm sure by SOL she means so out of luck. Davina, so let's talk. This is a great segue to start talking about. We've been talking about what health insurance might cover. Now I want to talk about how in the world do we know what our health insurance covers? Because honestly, most of us don't know. Maybe we should, but most of us have never read our health insurance policies. So let's start with, let's list some ways that people can figure out what their health insurance is. And Courtney leads us into the first one with her question that she went to, she doesn't say, but I'm guessing she went to her human resources department and was given a summary of benefits. So is that an effective, first of all, is going to your human resources department a good place to begin?
I think it is. You can try to get some clarification there, including a reminder to which plan you selected. The summary of benefits is just that. It's often one page or a few pages, very general, nothing specific. What I recommend that people do is find out the name of their plan, and then they can Google it. And then usually a PDF will appear that they can open up and look at. And the great thing about doing it online is you can then search for keywords. So you can look for anything: fertility, infertility, assisted reproductive technology. There are lots of keywords that you can look for. And the nice thing is it will even say excludes. So it might have OBGYN, general reproductive healthcare, excludes assisted reproductive technologies. So it helps you. I say it speeds up the process, so you don't have to request a very thick packet detailing all of the benefits that are provided.
So let me ask you, so what terms, so you're doing you've got it electronically and you're doing a quick search. What are some of the terms that you would specifically search for?
Well, if you know the condition that you have, you could look for endometriosis. You could look for the underlying conditions, but you can also specifically look for in vitro fertilization, intrauterine insemination. You could look for reproductive health. You could look at some of the other ones that I mentioned: infertility, fertility, anything with these keywords. And you should be able to find it either in what is covered or what is not covered.
So covered benefits or exclusions or restrictions are some of the section titles that you might see in your policy that this would be under. Either it's under your covered benefits or exclusion or restriction. So,
correct.
Okay, great. Now, Dr. Potter, if another place is, we've talked about getting information from your human resources department. How useful for most clinics, I know you can't speak for every clinic in the United States, but how do infertility clinics usually have somebody on staff that can help you as well understand your policy?
Absolutely. So, any reasonably sized fertility clinic will have insurance specialists who are very experienced and knowledgeable about contacting your insurance company and basically doing a benefits check for you, and they will determine whether you have IUI coverage or intrauterine insemination coverage or in vitro fertilization or assisted reproduction. They will be able to tell whether you have treatment or coverage for the evaluation process, and they should also be able to tell you, whether their clinic is in network or out of network, and what your obligations are. I mean, do they cover 80%? Do they cover 50%? And whether or not there is some sort of lifetime max. And then additionally, even people that have infertility coverage, they often have a yearly deductible, and sometimes it's, could be a couple $1,000s. If they haven't spent that yet, the first couple $1,000s will be charged to them. So But any good insurance, or I'm sorry, any reasonable fertility clinic should have on their staff, knowledgeable people that basically can walk through the insurance process with you and for you. After all, that's how the clinics would be getting paid.
Yeah. And I would even take that one step further and say that even if you think you've talked to your human resources, or another option would be just to call your insurance company itself and ask, talk with somebody. But even if you do that, I think it is smart to have the person who is at the infertility clinic you go to who is most knowledgeable about insurance, take a look at your policy just to confirm what you think you know. So I think that's just a good insurance. If no other reason, you want to make sure that the clinic knows what's covered and not covered. All right, Dr. Potter, generally speaking, people who are struggling to get pregnant start with their gynecologist. I mean, that's who you generally go to see. That's for all things having to do with reproduction. So what testing should you have done, or should you do with your gynecologist to increase the odds of your health insurance covering it, assuming that your health insurance doesn't have full infertility coverage? Are there some tests you should do there? Because it's more likely, the insurance company, if it sees a test done from a facility with the name infertility clinic, may be less likely to cover. So thoughts on that, or am I wrong? Perhaps there are no tests that you should just automatically have tests done at the infertility clinic.
I mean, I would say that, if you are infertile and you're less than 35 years of age, you've been trying to get pregnant for, let's say, less than 2 years, I think it's reasonable to go see a gynecologist initially. The test the gynecologist should do initially, the first test should be a semen analysis on your partner, because the bottom line is that if the semen analysis has abnormal parameters, that's way outside of what a gynecologist is going to be equipped to help you with. And anything they may do is most likely going to be a waste of time and money. So I would say that's the first test. The next thing that they should do is, do an evaluation of the female's ovarian reserve. And so looking at the ovarian reserve, especially taking a very thorough look at it, is really important. But, even just a cursory evaluation, such as a cycle day 3 FSH and estradiol level, at least it's a basic screen, and will identify women who have diminished ovarian reserve. And I like to use sports analogies, although most of the patients don't really, are big football fans. But part of it is we're trying to, initially, it's determining, where are we in the game? Is it the first quarter, the second quarter, halftime? Are we, in the fourth quarter? Is it like the 2-minute warning? I mean, we need to have a sense of how much gas is left in the tank. And, that also can dictate, or, help dictate what treatment is best for an individual patient. Now, I would say that patients that are over 35 that are infertile should just not go to the gynecologist at all, and just go directly to a fertility specialist, because they're almost certainly in the second half of the ball game. And, you don't really know where you are in that second half, and you do not want to be doing a bunch of run plays as the clock runs out on you, so over 35, just, go directly to the fertility specialist. In terms of, other tests that you might have done, if the other thing I would say in terms of just gynecology or gynecologists or OBGYNs treating infertility, is that like for example, the histosalpingogram is the test to check to see whether the fallopian tubes are open, and you push dye through the tubes and do an x-ray and then see if the tubes are open. And, they like to order that test, but do not have that test done to you unless your husband has a normal semen analysis, because if they do not have a normal semen analysis, it probably is irrelevant whether your fallopian tubes are open, and that's a test that is expensive and relatively uncomfortable for some women. And so, you don't want to have unnecessary things done. So there's a certain order and cadence that the evaluation needs to be performed in to avoid unnecessary tests. And, here in California, we have Kaiser, which is a big HMO. And, I'm not sure if they have fixed this, but, for a period of time, we helped cover their infertility practice because their practitioner had a health issue. And they required every single patient to go through a checklist of every single test, no matter what. You know what I'm saying? That's just before they could even be considered for treatment. They had to have a histosalpingogram, even if the husband didn't have any sperm and they needed a donor insemination, or if they had very poor sperm, I should say, and they needed in vitro fertilization, or if their FSH was 30 and they're, perimenopausal and they're not candidates for, fertility treatment using anything other than an egg donor, they still had to have a histosalpingogram, for example.
And that's it's both costly. It's also takes time, and time is not on your side. As we all know, we need to move into treatment sooner rather than later, because we don't need a lot of time to pass, because the older you are, the less likely that even with treatment you're going to get pregnant. So, and as you point out, some of these tests are uncomfortable. So for all of those reasons, it's best, if you possibly can, unless your insurance absolutely requires it, to be talking with a specialist to understand which tests are actually required for you and your specific situation. Davina, now, if we're talking about, so people have been at their gynecologist for a certain period of time, and they have heeded our advice and are now getting ready to move to a specialist. Do they need a pre-authorization letter or a pre-certification letter, assuming they've got some coverage?
I think it depends upon the type of plan they have. HMOs usually require a referral to a specialist, where a PPO plan, a preferred provider plan, you can just go directly to the specialist. Once you're at the specialist and they have the benefits department, they usually receive a pre-authorization letter, or the patient can also call, and when they inquire about the benefits, if the insurance company says yes, they can ask to receive that in writing. But likely the insurance company will not say if they're authorized or not, because they don't have the medical codes to be able to refer to. So the pre-authorization letter really goes directly to the clinic for the most part, and then the patient just wants to get a copy of that. And I've worked with patients before who had a pre-authorization and they were going to be starting their medication the very next day, and the insurance company calls and says a mistake was made, they no longer have coverage, but they've always won an appeal because they had a copy of that pre-authorization letter.
And where should you get it? You should go, the pre-authorization letter is usually sent from the insurance company to the clinic. So so the patient should go to the clinic and say, I want a copy. Is that how that would work?
Yes, they can ask for that. Or if it's already been issued, they can ask the insurance company for a copy of the letter.
Okay, well, yeah, that's assuming the insurance company hasn't said in the situation you just described that you are denied, because they would probably be not wanting to send you that pre-authorization letter at that point, but you could get it from your clinic. if you needed to. Okay. All right. And is that the same thing we sometimes hear of, a letter of predetermination of benefits? Is that the same thing?
It is.
Okay, gotcha. They're just all different words for the same thing. Okay.
Yes.
All right. Now, so we are now at the infertility clinic, and you're working with a specialist. Dr. Potter, how can a patient, or how is the best way for a patient to work with her doctor to maximize her insurance benefit, to get the most out of the coverage, and to reduce out-of-pocket expenses? And this is now, if she has no insurance, that's a separate issue. But let's say she does have some insurance, but she has the more typical limitations, which might be a lifetime limit, dollar limit, or a number of cycles limit, or a requirement that you go through X number of IUIs. That intrauterine inseminations, sometimes called an artificial insemination. So what as a doctor, what do you want patients to do, and what's your role in helping patients maximize their insurance?
Well, I mean, you have to have a fertility specialist that is, first of all, has, an insurance specialist on staff that is going to determine the benefits. And then you also have to have a fertility specialist who's going to pay attention to that that information, so that part of the informed decision-making process for a couple going through fertility treatment is going to include not only evaluating them and giving them all of their treatment options along with the probability for success with each, but also having them understand what, if any, insurance coverage they have for each one of them, so they can properly do effectively what is a cost-benefit analysis on each one of these treatment options, and then make an informed determination as to what they want to be doing moving forward. And, I find that when patients are not given all of this information and don't make a fully informed decision, that's when you end up with regret. You end up with someone who blew through all of their benefit getting unnecessary testing or, treatment. I find the requirement for, at least, that's true here in California, when people do have coverage, and there are, employers that have coverage out here, I don't see as much of the mandate where you have to do 2 or 3 IUIs before you can do in vitro fertilization.
I think that is becoming less, and it's becoming less because there's been some really strong research that has shown that and I think your term cost benefit analysis is a really good one. But there's been some wonderful research that has shown that from a cost benefit standpoint, which, let's face it, is what the insurance company most cares about. And from a cost benefit standpoint, the cheapest way is often to go straight to IVF. Now, we're not making medical diagnosis here, so you need to check with your provider specifically how it would apply to you. But I think that's why we're seeing less of it. We're making headway, and insurance companies may be listening. So for that, I'm immensely thankful. So what I'm hearing you say, Dr. Potter, is that a patient should expect that this is especially the case if they have limitations on their coverage, which, let's say a dollar limitation or a number of cycles. They should go to their doctor and say, my end goal is to ideally have 2 children, or whatever their end goal is. What type of plan can we create that will make the best use of the dollars I have that my insurance is going to cover to get me? And so how can we best utilize the limited dollars that I have, or the limited number of cycles I have? Is that something that doctors are receptive to? taking a look at it from the limits that the patient is facing.
I think that the majority of doctors are receptive to that, and they should be. And if you have a doctor that doesn't seem to be, you might consider finding one that is.
Patients should expect that. That's the point. You should expect a doctor to work with you to help you maximize your benefits, because money is real, and that is a real limitation. I mean, obviously it's real, but it's also a real limitation for people accessing care. So it's a reasonable expectation to have of your doctor, I think. And I'm hearing you say the same.
Right. It's almost as if, for a lot of these patients, they have a magic wand that can perform one trick. Like, what trick do you want to use it for?
Yeah.
I mean,
yeah.
And so, it's incumbent upon, the patient to also be an informed and responsible customer and consumer, and to, take that step to understand their care. I would say that it's the minority of patients that really even have any idea or think about it. Like, we're usually, telling them information, and, often they're like, they didn't even know that they had any coverage at all.
That's, I'll give an example. We run a really large online support group and creating a family. And someone very recently was talking about they had, I believe it was 3 IUIs they had to perform. And what they were able to do was they went to, they were already at an infertility clinic. They knew that they were going to be having problems. And so they went straight to an infertility clinic. They did heed our advice, always good to know. And rather than have the IUIs covered by insurance, they chose to pay for the IUIs out of pocket, and they went to their gynecologist to have the IUIs done. It was less expensive for them to pay for out of the pocket. And then they were able to save all of their limited benefits to apply to an IVF cycle. I don't know how common that is, but that is how one person. Davina, have you seen something like? Is that something that you've seen patients do? That kind of creative, out of the box thinking about how to maximize benefits?
Honestly, no. Usually the patients that I'm communicating with, they are in shock, they're overwhelmed, they're frustrated, they're confused. I would say probably 10% are creative and thinking out of the box, or have learned things from online groups, or the information that's available through blogs and podcasts.
Yeah. I think you may be right. This person had been in the group for a while and had learned a lot. And actually, she said that was one of the reasons that she chose the path that she did, was she had learned from other people's mistakes. So you're probably right. Davina, let's talk about how to minimize your out-of-pocket expenses, because not everything, most often, not everything will be covered. So Dr. Potter mentioned one, which is making certain, if possible, that you are going to whatever labs your tests are being run by are in-network labs. And honestly, how do you know? How do you know if your lab? How do you know? I mean, most often you go to the doctor, they run a test. You have no idea what lab the clinic is using. So how's a patient supposed to know that? Wouldn't you? Is it just logical to assume that whatever lab the patient is going to use is going? Not the patient, the clinic is going to use. If the clinic is in network, wouldn't all labs be in network?
I think that's a question for Dr. Potter.
And so the answer to that is that, you can use, we can send the blood work to any laboratory. We could run it in-house. We could send it to Quest. We could send it to LabCorp. We could send it to some mom and pop laboratory. And, when you have an insurance department, one of the things that they do is determine where to send the blood. And that's on the insurance determination that they do. And in the case of our clinic, we actually put a sticker on the patient's chart that has the name of whatever laboratory they need to have their blood sent to make sure that it's covered.
Okay. So the answer is that a good, hopefully a clinic will make darn sure that by having read the policy, but it's possible. It is possible to have a lab being used by the clinic that is out of network while the clinic itself is in network. So that's a question that patients should ask, and that hopefully clinics would on their own figure out and know. Let's talk about the yearly deductible, because you're right. Many people, even if they're blessed with good insurance, have a deductible. So, Dr. Potter, from a practical standpoint, how can you maximize? I know in other areas, one time one of our kids had broken a leg, and in a skiing accident, and it was mid-year. It was actually kind of at the beginning of the year, in the spring, and we realized we had blown through. We had a very large deductible, family deductible. When we realized we had blown through the deductible, it was like, okay, what else can we get done this year? So. How do we, okay, everybody, let's take a look at our bodies and figure out what we need to do. So how, from a infertility standpoint, what are some things that you can work with your doctor once you've paid your deductible, especially if it's a large deductible?
Trying to get treatments done prior to the end of the year, so that it doesn't before it resets. So if you can get your, if you've met your deductible for the year and you have fertility treatment that's covered, then it would definitely behoove you to be working with a clinic that was able to, move things along in a timely fashion so that you could, complete the treatment before the end of the year.
Mm-hmm. And it's a fair question to ask. I think that's sometimes what holds patients back. They think that that's not a fair request. But Dr. Potter, as a physician, do you feel like that is a fair request? Somebody saying, it's November. I really need to get this. I need to get this and this done before December 31st.
Well, we have that happen all the time.
Yeah. So
again, it takes, to some degree, you have to have an insurance department at the clinic, but you also have to have a savvy patient that's on top of that, that's not asleep at the wheel. And, it's I don't know, I guess interesting. I don't know what the right word would be, but the percentage of patients that are kind of asleep at the switch on this stuff is relatively high. And so, like I said, I think it's incumbent upon the patient to be their best advocate, and to ask questions and to, demand answers. And, I would say that most patients are not in that category. And if they're fortunate to be, in a facility that already does all these things for them, it makes life a lot easier. They don't even know these things are going on. And we might remind them that their deductible has been met, and, January might not be the best month for them to do their cycle, even though that's when they have time off for work or whatever.
Mm-hmm.
So,
well, honestly, that's exactly why we are doing this show, is that we want to educate. We want there to be more. We want to increase the percentage of savvy patients that you get. if money is an issue. And there, for some patients, money is not an issue. But I think for the vast majority of infertility patients, money is an issue. So maximizing their insurance benefits is a really important thing. Let me just briefly touch on insurance coverage for third party, egg donation, sperm donation, embryo donation, or surrogacy. Davina, how common is that? I think, or can you buy separate policies? How does that work if treatment using your own gametes is not an option?
Right. There are policies, they're called like a rider policy, that you can ask your employer to consider purchasing and making available. So this would be something separate, but an additional option to include with your policy. I see a lot of employers are now having multiple plans to offer their employees, one with infertility benefits, one without. The one with usually has more unlimited, so it would cover third party. I think we see more coverage for donor egg, donor sperm, donor embryo than we do for gestational carriers. And it's really a shame because the procedures are very similar, just not necessarily done on the same individual. But the cost to the insurance company typically tends to be the same. So what we are, we're trying to educate people about that and to guide them where to try to gain those benefits and where to try to save money, like you mentioned before. So for example, if they're paying cash, we usually recommend to people to pay money toward the IVF cycle, and then try to get a discount program for their medications to stretch their money as far as possible. Because third party and gestational carriers, there are a lot more fees related, not only to medical, but as you know, legal fees and
Right,
counseling
right.
fees, etc.
Let's touch real briefly on the same-sex couples who are, with lesbians, there may be infertility involved as well. Well, same with gay guys as well. But for if there's not biological infertility, but they are not able to conceive, obviously, because they need a donor gamete. Davina, thoughts on policies and how insurance handles that? They obviously cannot get pregnant without, or if they're a gay couple, they need a surrogate. Any policies are you seeing an increase in policies that were working with the LGBTQ community?
I do believe there are. There is an employer that I met with in New York. And what happened was they had so many employees come to them with all different stories that they felt they needed to offer benefits without limitations. Otherwise, they would be discriminating against one group or another within their own company. So I think employers are recognizing this and offering benefits without discrimination. I know I've worked with same-sex couples in the past. And one thing, if they did have an underlying condition, if the clinic submitted diagnosis codes or treatment codes individually rather than grouping it as in vitro fertilization, patients had said they received about 85% of the treatment was covered by the insurance carrier. So I think the mindfulness of the clinic is extremely important.
And the mindfulness of the clinic and also the mindfulness of the patient. Yes. Because we are responsible for knowing our own policies and advocating. We're also responsible for advocating for ourselves. But it helps to go to a clinic that is willing to work with you completely. Let me remind everybody that you're listening to Creating a Family, and this show, as well as all the resources we provide on all these topics we're talking about, we have resources at our website, creatingafamily.org. And all of this is brought to you by the support of our partners. And these are clinics and organizations who believe in our mission of as we're talking here today, of creating an educated and supported patient population. And some of our wonderful partners include Reproductive Medicine Associates of New York. They are one of the largest fertility practices in the state and one of the biggest in the country. By combining the latest innovations in the reproductive sciences with compassionate and customized treatment plans, RMA of New York is able to provide the very best possible care. And we also have Cryos International Sperm and Egg Bank. They are dedicated to providing a wide selection of high-quality, extensively screened, frozen donor sperm and eggs from all races and ethnicities for both home insemination and fertility treatment. The last thing that I want to touch on is I just want to make a plug. I know earlier, Dr. Potter, you said that there are companies who are, even though it is not required by their state, are insisting, and even self-insured or otherwise, insisting on offering policies to their employers that will cover some degree and some quite generous degree of infertility treatment. And you said it was in the goodness of their heart. I would say that it's actually in the goodness of their business, because I believe, and there's been some good research to support this, that it is a good business decision to do that. You get loyalty from your employees. It's a great recruitment tool. And it actually isn't that expensive, even though the perception is that it's going to be that expensive. We don't have time to talk at length, but let me recommend that you go to the resolve.org website. They have some extensive resources there on how to advocate for getting coverage. And Davina, I believe you've got some resources at your site also.
Yes.
For advocating for coverage. So let me just recommend that if your company does not currently offer, don't make the assumption. Most employers tell us that the reason they don't offer insurance for coverage for infertility is that no one's asked for it. So, by golly, ask for it. Davina, give us your website so that people will know where to get more information, not only about advocating, but also about everything we're talking about today.
That's great.
Because you've got a lot of resources on that.
Yes, thank you. So it's Fertility Within Reach, all one word, fertilitywithinreach.org. And we do have information on communicating with your insurer, legislator, and employer, as well as a section about financial assistance. So there's lots of resources to help people figure out how they're going to fund their fertility treatment.
And for people who are wanting more information about Dr. Potter and HRC Fertility Clinics, they have one of my favorite all-time URLs. It's called havingbabies.com. Whoever was smart enough to grab that URL, Dan, at the beginning was quite smart, because I really enjoy that. Let me tell you that the views expressed in this show are those of the guest and do not necessarily reflect the position of Creating a Family, our partners, or our underwriters. Also, keep in mind that the information that we've been talking about in this interview is general advice. To understand how it applies to your specific situation, you need to work with your infertility professional. Glad you all joined us today. Thank you so much, and we will see you next week.